Here on Martha's Vineyard, we have a very high incidence of Lyme disease. So it's very important to be able to test for Lyme disease here in a rapid fashion, consistent with clinical guidelines from the Centers for Disease Control. The hospital feels it's critically important to provide this service for patients so they get an immediate answer of whether or not they have early infection with Lyme disease, have ever been exposed to it, or have an active infection. There are two types of antibodies that your body produces when you have Lyme disease. The first type is what's called an IgM antibody. Those antibodies occur early in the infection and can last for years and months beyond when you've had the disease. The other type are IgG antibodies. Those antibodies are only present in active infection. In order for any laboratory test to pick up these antibodies, it takes 2 to 4 weeks after you've been bitten by a tick that is carrying the Lyme bacteria. So all of these tests are only as good as if you've waited long enough to be able to pick up the antibody response. If your Lyme test is done and it comes back negative, you should ask your doctor if you should come back within 2 to 3 weeks and be retested. Be wary and watchful for rash and other known symptoms of Lyme disease, and make sure you tell your doctor so that he can treat you. It's a very high likelihood that should you come in to see your physician and you tell him that you think you've been bitten by a tick, you will receive antibiotic treatment.